As a patient, you're frightened, you're scared. Once you've been given that diagnosis that you're actually having a heart attack, it becomes reality and the denial is taken away.
The Heart and Vascular Center at Memorial takes a team approach to treating patients suffering from heart attacks. If the patient arrives by ambulance, the ambulance has the capability of performing an EKG in the field or at your home. The paramedics are trained to identify a heart attack, so it can be relayed to the hospital. The hospital can then activate a code STEMI before the patient even arrives, ultimately saving further damage to the heart. If the patient is not coming by ambulance, potential heart attack patients should go to the registration desk. From there, our team will take them to triage or the bay to perform an EKG. At the Heart and Vascular Center, our rule is to give an EKG to someone with heart attack symptoms within 5 minutes of their arrival. The first EKG is done in the bay along with blood work. A repeat EKG is performed at the 10-minute mark if your symptoms continue. If a heart attack is diagnosed, a code STEMI is called. That means all areas involved should prepare for a heart attack victim, including the cath lab. A STEMI is a type of heart attack in which a blood clot completely blocks the coronary artery, causing affected heart muscle to die. The goal is to restore blood flow to the affected artery, preventing further heart muscle death. Patrick Murphy experienced this firsthand.
I came to the Heart and Vascular Center. I was developing some chest pain and tingling in my arms, not knowing what was wrong. I was immediately diagnosed as in the process of having a heart attack.
If the patient is experiencing chest pain in the ER, they may be given medication to help relieve pain and improve blood flow to their heart. The patient is then prepared for the procedure that takes place in the cardiac cath lab.
Within minutes, I was taken to the cardiac cath lab where their team of technologists and nursing staff greeted me and proceeded with the cardiac cath.
Once in the cath lab, the staff takes the patient to the procedure room where they are moved from the stretcher to the X-ray table. At this point, the patient is taken off the portable monitor and put on a regular monitor. The patient is then draped and prepped with an antiseptic solution. Next, the doctor comes in wearing a lead barrier, and the nurses tie the doctor in a sterile gown. The doctor and the technician begin the cardiac cath procedure while nurses assist by handing them supplies and medication. A tech records this entire process. Nancy Rakowski was sent to the cath lab after experiencing a squeezing sensation in her neck while working out.
The staff was great. They were actually wonderful, and they got me all ready and they moved me into the room, the cath room, and I was laying there and Dr. Aziz comes in and, he goes, "Do you want to watch?" I said, "Not really."
During the catheterization, a sheath is inserted near the groin. The sheath is like a large IV, and when it's inserted, the patient will feel pressure. Through the sheath, wires and dye are shot through the artery. The dye causes a warm, flushed feeling, and digital images of the heart are taken from different angles.
And they're talking back and forth, and the next thing I know, it's dead silence. And I knew then when it got quiet, I knew something was wrong. And the main artery in my heart was 96% blocked.
At this time, the doctor has to decide if the issue can be resolved with a balloon or stent in the cath lab, or if another course of action is needed. Other options may include meeting with a thoracic surgeon or medication management. In Nancy's case, a stent was needed.
He said that he was going to have to call Dr. Mahmood to see if he would be able to put the stent in because of where the blockage stopped. It stopped between another artery. They were not able to get it in because it kept going off to the side. Dr. Mahmood had tried and it kept going into the small artery, and then he finally told me that if it didn't go in this time, that we would probably have to do open heart surgery. So I'm laying there and he says, "Nancy?" And I said, "Yes." And he goes, "You are going to feel like an elephant sat on your chest." And the next thing I know, he was right. The stent got in. And I changed my life around after that.
It's important to know that every cath lab experience is different.
It was very quick. It seemed like fast. Everything was explained to me. I proceeded through the process. Dr. Mahmood was my cardiologist. explained everything to me, showed me on the monitor, gave me some options of what could happen. As the process went on, we went in and put some stents in and showed me where the stents were and said that, the prognosis was good.
Once the catheterization is completed, the patient is returned to a stretcher or bed and taken to a recovery room in the cath lab or the ICU.
You felt very safe with them. You felt like that your fears and all your worries were taken away because they were there. And so many times they would reassure me, I'm here. There was one nurse individual that stood by my head, and many times she said, Pat, I'm here for you. I'm here with you. And I never was afraid. I felt very safe in their hands.
To learn more about the Heart and Vascular Center at Memorial, visit memorialheartvascular.com.